Tonight on 15-minute videos, improvement of speed, cost, and efficiency with the implementation of electronic health records.
Over the years, the healthcare system has become more advanced in technology, making our transition from paper-based practice to computerized process and systems. This enables clinicians and patients to easily access personal records from one database. Electronic health record is an official health record for an individual that is shared among multiple facilities and agencies. These are the list of things that are included in the electronic health record. Electronic health records implementation has improved clinicians' productivity by improving quality and efficiency in patient care. Throughout this 15-minute video, we'll be showing the three concepts of electronic health records. How it ease of contact and communication between healthcare providers such as clinicians and patients. To ensure records are accurate and up-to-date quality standard. And lastly, clinical decision support system.
So, integrating technology within the healthcare system would mean better communication between healthcare professionals. This would mean that medical history is readily available to the physician in multiple settings through the electronic medical record, so the patient does not need to fill out endless paper forms each time he or she goes to a new healthcare professional. Also, lifelong health history of the patient is easily accessed by multiple practitioners through the electronic health record for better and accurate care and treatment. Let's discuss further benefits. So this also helps with collaborative chronic care management, which is highly useful in the age of growing chronic medical problems because it cuts back money and time that would have been spent on unnecessary repeat tests. Also, data exchange between practitioners would become easy and fast, which means less time would be needed to make a diagnosis. This would greatly help in many-to-many relationships of patients and practitioners. For future implications, there may be privacy and access issues that may hinder the full potential of integrating technology within the healthcare system. This short clip would demonstrate how technology is useful in checking the patient's medical and health history quickly and efficiently, and even with multiple practitioners, there is a cohesive and retrievable treatment information available for the patient.
Hey there, what seems to be the problem today?
I have a really bad headache and I have a bad sore throat and been freezing for the past few days.
Okay, could I see your throat? Okay, it looks like a bacterial infection. Let's see, I can prescribe you some antibiotics here. Should be free within a week or so. And there you go. You can pick your order up at the front desk.
Okay, thanks, doctor.
You're welcome.
Good afternoon, Sejal. So what brings you here today?
Well, last week I went to the doctor because I wasn't feeling well and then they gave me antibiotics because they thought I had bacterial infection, but it hasn't been getting better. It's been getting worse and worse.
Okay, can I see your throat? Yeah, well, that is not just a bacterial infection. I believe you might have a viral infection called mononucleosis, and the bacterial infection might be a secondary infection developing due to the lower level of immunity of yours. So let me just check your medical history to make sure. Well, I see Dr. Joel prescribed you antibiotics for the strep throat you had. You don't have, are you pregnant? No?
No.
No, any medical problems?
No.
I guess we can get blood work done for you to be sure that it is mononucleosis.
Okay.
Until then, I can prescribe you some gargling liquids. Will reduce the inflammation so you can sleep better. Let me just check. Okay, your order should be at the front desk.
Okay, thank you,
Thank you.
doctor.
Electronic health records have the potential to greatly improve both the efficiency and the quality of patient-centered care through improved documentation. With the aid of standardized tables, system checkpoints, built-in edits, and reminder alerts, the use of EHRs can help ensure structured and consistent data collection. These functionalities can also be used to ensure that mandatory data elements are not bypassed, thus minimizing medical errors and ensuring the completeness of health records. EHRs also improve the quality of medical documentation by increasing legibility. Handwritten paper medical records are often difficult to read and can be easily misinterpreted.
Dr. Can.
Falcon, are we all prepared for surgery today? We have to get this one done quickly. Did you get the lab results?
I got the documents, but I'm unable to figure them out.
Oh, can I see them, please? Falcon, can you please move the surgery to 2 o'clock? We're going to have to do another lab test before you can proceed with this surgery.
It's an emergency transplant.
As you can see, illegible medical documents can cause significant problems. Illegible handwriting can delay treatment, lead to unnecessary tests, and in some cases can even result in death. Let's have a look at scenario 2.
Dr. Can.
Falcon, are we all prepared for surgery today? We have to get this one done quickly. Did you get the lab results?
Did. The patient's creatine levels has gone back down, and she's cleared for TB.
Perfect. I'll see you in surgery.
Much better. In this case, the legibility of the EHR allowed for events to flow more smoothly.
Such a vast improvement over paper. The system just improves your efficiency. There's just no going back.
The next topic we will be going over is the Clinical Decision Support System, or the CDSS for short. Without the implementation of the CDSS, doctors have to rely on memorization for every single treatment or diagnosis that they have learned, or look through their resources to find the information that they need. Now, although it is possible for some doctors to remember everything they learn, the fact of the matter is that from time to time they can forget or miss critical information. This can not only lead to decreased productivity for the clinician, but may also result in a misdiagnosis. The purpose of the CDSS is to assist clinicians in making decisions by incorporating evidence-based data along with a patient's electronic health record in order to decrease errors, optimize productivity, and ensure no information is missed. With the integration of electronic health records and the CDSS, there has been an increase in clinician productivity and care, and can lead to a decrease in misdiagnosis and incorrect prescription of medication.
Hi Joel, how are you doing today?
You know what? Not so good, Doc. I could be doing better.
Well, what seems to be the problem?
Well, I'm experiencing stiffness in the morning, and I'm really not getting any good sleep. And I'm also noticing sensitivity to some light and temperatures.
Oh, okay, well, based on your symptoms, I have a good idea of what your problem is. Just give me a second. I'll be back. Hi, so based on your symptoms, you have lupus, and so we're going to start your treatment momentarily, okay?
Okay.
Hello, Joe. How are you doing today?
Not so good, Doc. I went to see another doctor about a month ago. They gave me a prescription, but I don't see any improvement.
So what symptoms do you seem to be experiencing still?
Basically the same ones. I still get stiffness in the morning. I go to bed and I wake up feeling tired still.
Okay.
And I feel sensitive to light and temperature.
All right.
Well, I can see here that the doctor that previously diagnosed you with lupus seems to have missed something critical.
Oh, really? What's that?
Okay, Joel, I'm just looking at the screen right here. As you can see, the electronic file shows that a year back you had experienced sharp pains in your heart and developed a rash across your face. What the CDSS shows is that there's a correlation between the symptoms you had a year ago and the symptoms you are describing today.
Oh, yeah, but I had no idea the two were related.
Well, they were. It's a good thing that I have a clinical decision support system here in my office to alert me of your past conditions. With all the information I now have, we can move forward with testing you for fibromyalgia and hopefully get you feeling better soon.
That sounds great, Doc. You're a lifesaver.
To conclude today's episode, let's review what we've talked about in the special episode of 15-minute videos. We started the show today with an introduction to electronic health records and its impact on today's clinician productivity. With EHRs slowly being integrated within most medical institutions, communication between healthcare providers are becoming much easier. The documents are more accurate and up to quality standards. As reviewed earlier in today's episode, an excellent tool in today's medical institutions to help with proper and quicker diagnosis is the Clinical Decisions Support System. Imagine being left-eye dominant, but taught how to shoot an arrow with a bow right-handed, forcing you to aim with your right eye. After a few years of training this way, it is safe to conclude that at that point, you are better at firing a bow right-handed than left-handed. The fact is, you are not aiming with your dominant eye, therefore you will never achieve your maximum potential. Switching over to your left side, however, at first, you will realize that you are not as good at drawing the bow, or at aiming, or even at holding the arrow straight. But after a few years of practice, since you're using your dominant side, you will achieve a greater potential and find yourself more skilled at firing a bow. Much like in this examples, electronic health records may be a little confusing to get used to at first. The process of getting things to run smoothly will take time, but in the end, the healthcare system will achieve a greater potential. Thanks for watching.